Hi, I'm Dr. Brian Hutcheson, and today Dr. Kathleen King has joined me. And Dr. Kathleen is a founder of Primal Trust. Kathleen, tell us a little bit about what got you into brain retraining and really where the concept of your program.
So I was somebody who was sick with all sorts of different diagnoses, ranging from Lyme disease, mold toxicity, chronic fatigue, viruses, parasites, that typical person that has a lot of things going on. And I went from doctor to doctor, protocol after protocol, was taking tons of supplements, and I wasn't really making a lot of progress. And to the point where I couldn't afford to keep doing that. So at one point I had to take a step back and look at the overall picture. What is the common denominator behind all of my different diagnoses and everything they're finding on these lab tests? What's actually going on, because what I'm doing isn't working. And I realized that as I looked at my situation, the autonomic nervous system was a player in all of those things. And so I started doing some research, and I realized that indeed the immune system and the detoxification system and all of those things were regulated by the brain, the limbic system, the autonomic nervous system. And so I switched my focus onto things like brain retraining, vagus nerve toning, somatic practices, and trauma repair. And that's when my symptoms started to fall away and I got my function back. And I realized this is what people need to know. I mean, I wanted to save them the 10 years that it took me to find that solution. Wow. And spent everything, I mean, to the point where we were bankrupt. I wanted to save people that time. And it's not that what they're dealing with isn't real. It's just that a solution that is systemically focused versus pathogenically focused seemed to be a better angle for me and for many, because chasing the pathogens and the toxins, while it's somewhat helpful, the system, the body system, the autonomic nervous system is really the big deal here about why you're stuck with these chronic infections and chronic toxicity. So that's why I created Primal Trust.
That's an amazing story. And just to go through 10 years of looking for answers and feeling chronically ill, and to be able to take control of it almost into your own hands and start to experience relief. I mean, that's really miraculous and impressive. Something interesting that I think of when you tell your story is that many people are walking around and they have bacteria, they have viruses in their body. They may have a little bit of an abnormal mold or a stool test that has a pathogen, but they still, in general, express health. And that tipping point between the individual that becomes susceptible, where their immune system can't tolerate those pathogens, is kind of, I think, where your work comes in, which is if your body doesn't feel safe, if you have a ton of stress that you're not addressing correctly, how would you explain how there's that tipping point between, if you and I are around somebody that had a virus right now and we wouldn't get sick, but what's that tipping point look like to you?
It basically is a person whose body is dealing with too much all at once. And it's almost like a confusion happens inside the autonomic nervous system. Do I use my energy to run from this perceived threat? Do I try to digest my food? Do I fight this pathogen that I'm being exposed to? Oh, do I detoxify? And when the brain and the nervous system is overloaded with, things aren't going well in my life, I've got too much going on, this sense of doom, the autonomic nervous system can't follow all of these commands, and something's got to give. Something's got to give. And with our survival strategy, we're wired to survive. We're wired to run from the tiger. And we're not going to be digesting our food and effectively fighting infections when we're running from a tiger. So the person whose tipping point happens is the person whose mindset is that I'm not okay, things are not okay. And the other person who might have the same exact exposure, if there's somebody who trusts in life a little bit more, takes things in stride, decompresses after a long day, knows how to sit and chill out, their system is going to have more resiliency to handle those pathogens and toxins. And that's why you'll see people in the same home, same moldy home, one person gets extremely ill, the other one doesn't feel it at all. And it's not just genetics. You might say, oh, they've got a genetic predisposition. Sometimes, but not always.
Yeah, that's a great point. It's the cumulative stress and not periodically figuring out how to dump off some of that load that ends up where your body gets a pathogen or exposed to a virus or an illness, and it can't mount a defense because you've got this survival mechanism that's overshadowing it, and that your body feels survival is much more important than fighting this bacteria. It's interesting because as much as you and I are all about the body has built-in ability, an innate ability to heal itself, and I think that's something that we both deeply share in common. And we know because we've seen it firsthand with ourselves, with what you've done for yourself to help you heal. And I've seen it on my own as well. When I just make changes to my posture or my mindset, that I can start to express health when otherwise I would feel like I was about to get sick. So make sure that you always do consult with a licensed practitioner if you have a serious health concern. With that being said, anytime that you're going through a procedure, for example, you're getting treated for cancer, or you're getting treated for Lyme disease, or you know that you're going to need a surgery for a disc herniation, you still can be doing things to increase your chances of a meaningful recovery with things such as brain retraining, with things like gentle postural awareness and changing your sleeping position, working on exercises that may not be contraindicated for your case, consulting with somebody that can help you to clean your diet up. The possibilities that are out there to have complementary care, even in the face of something serious, are endless. So, hopefully you'll find inspiration through this talk.
I want to say that I really think a true win-win is if you are in the thick of some type of chronic infection, toxicity, doing your part, the nervous system part, the brain retraining part, your exercises, your postural exercises, things that are all going to help to influence the nervous system is one piece. But if you can find a practitioner who understands the approach you're taking and can give you assistance with tools and protocols to help optimize your body function, I do believe that's a win-win. So to be clear, it's not all or nothing. You don't have to choose one side or another. I do think that approaches can really combine nicely when they're done with the right mindset. What I see people do that I think doesn't help them is when they want their doctor to save them, when they want that protocol to save them, when they are expecting this pill to be the thing that fixes everything, and they're not taking responsibility for their own nervous system state. That's the big delineation I want to make here. Take responsibility for what's yours, the state of your autonomic nervous system to the best that you can, while maybe combining with other protocols that can optimize the body, not fix the body.
Yeah, that's a great point to bring up, is that even if we do need intervention, medical intervention, that what is the reason that we got sick in the first place? Back to our initial point about Kathleen and I, Dr. Kathleen and I could be in a room with 3 people with a virus and we may not get sick. We may, but we may not. And what is the reason why? So how can you increase your chance of being the person that doesn't get sick, even in the face of adversity? Life is difficult. We're exposed to traumatic events, emotionally, physically, chemically in the world we're in. It's so hard to avoid, all of the different chemicals that are in our food, that are in the air if you live in a city, and all of the radio waves and electronic frequencies. And often it's not just a genetic reason why these individuals can stay healthy in the face of all of these toxins and pollutants in our modern world, but the people that do, they've really worked through many of the things that Dr. Kathleen said. They're working through previous emotional trauma. They're working on their posture. They're improving their mindset. When they start to feel something bad, they sit with it and allow it to be present, but they kind of, as a metaphor, put it next to them, and then they, focus on what they want, which is, okay, I know you're there. My feelings of self-limiting beliefs and reasons why I can't get better are here, but I'm going to choose to focus on the one way that I can get better. And if you stay and live in that space, more and more answers will come to you. And it also does help to strengthen the nervous system as well.
Yeah. I believe that something happens when we make that decision that we can get better, and I'm going to do my part. Solutions will come to us. People will come to us. Books, theories, practices, we attract that which we have decided is true for us.
Yes, I agree 100%. Dr. Kathleen, we've already covered it a little bit, but tell me if you have somebody that has been on a journey, they're chronically ill and they haven't gotten a clear diagnosis. So they're not somebody that necessarily needs to be on medicine. Nobody knows what's wrong, but they're feeling any kind of symptom, whether it's just fatigue, brain fog, difficulty focusing, headaches, lack of zest to approach life. There's something bothering them. And they start with a brain retraining program, which should be, I believe, the first place that they start. How's your thought process on when they need to maybe consider adding in supplemental or complementary interventions besides just brain retraining?
It can be a tricky question, but what I'd say is if you're doing your part and you really are working on your brain, which is your sense of safety in the world, and your nervous system, your ability to relax, and you're doing these practices, and yet you're still noticing chronic stuff. Maybe you're having brain fog or dizziness or joint pain that's just not going away. Well, that might be a sign that despite doing the nervous system work, there's some other things that you're needing to find to help optimize the nervous system function. One of them being obviously the kind of work you're doing, which is looking at the spine and the cerebrospinal fluid and the flow and the way the brain is communicating with the body. I think that that's a huge missing piece in this community. It was one of my missing pieces that, I got my function back pretty well. I mean, I'm running a business, but then I started getting some weird head symptoms that didn't make sense when I was doing my regulation practices, and I find out I had a pretty significant upper cervical instability, which is a structural thing, and I'm a physical therapist, and I know how important that optimizing our structure is for the health of our brain and nervous system. Sometimes when I speak about this, people will criticize and say, well, Dr. Kat, you say that everything is just about brain retraining and nervous system work, and now you're talking about chiropractic or physical therapy exercises and structural stuff. And I'll say that is brain and nervous system work. It really is. So tell us about that. I'm curious about, do you see people like me that are optimizing their nervous system, yet there's this missing piece?
Yes, I think that was beautifully said. And chiropractic, physical therapy, working on alignment, curvature, and stability of the human structure and form is nervous system retraining and or brain retraining. And sometimes we need to have the thought pattern start the nervous system retraining, and other times we need a stimuli that sends an afferent impulse to the brain, and then the brain can kind of recalibrate and reset. And it's really interesting. They work together hand in hand. And as a chiropractor, I'm regularly doing a little bit of the thought process brain retraining with my clients or my patients, especially the ones that keep getting hung up on that same limbic or emotional type of trigger. Example would be that, John says, wow, my posture is improving. I'm feeling less pain, and it's down 80%, and then goes home and sleeps wrong, and then all of a sudden the pain is 10% worse, and then goes right back into this rat race track of, I'm never gonna get better, what's wrong? And they panic immediately. So the brain retraining, and that's why I believe after being a chiropractor for almost 12 years, that the kind of work that Dr. Kathleen does is imperative for anybody that's been chronically ill, because we get stuck in these patterns and thoughts that we have to break and reset I am well kind of a mindset, which she can explain it much better. I do it generic, but taking that broken pattern of illness back to a feeling of whole, that I'm whole, I'm complete, I'm well, I'm on the path to healing, and being able to completely embrace that once you hit a certain level of understanding that you're on the right path, to not keep falling back off the edge of that cliff, that into this same doom and gloom cycle.
Yeah.
Chiropractic, specifically the kind that I do, I think that it really helps with the brain retraining, and so do any forms of physical therapy and chiropractic, but the curvature is very imperative for optimal both blood flow from your heart to your brain to your heart, and also your cerebral spinal fluid flow. And then a very common missing link that I've spent the last 2.5 years developing has been addressing connective tissue that becomes sympathetic dominant. And with individuals that do a ton of brain retraining, mindfulness practices, breath practices, somatic awareness, they can temporarily get these areas to calm down and sometimes even get them to heal. But when there's enough connective tissue dysfunction, the sympathetic dominance in that tissue remains, because it's an alert to the body that if you use me too much, I may rupture the tendon off the bone, which could be a life-threatening event. So while I also believe that most people are able to heal from home on their own, there comes a time when you do need physical intervention.
Yeah.
Yeah.
And that's why I'm here. I've had the privilege of getting to work with Dr. Brian the last few days, and it's been amazing to experience your technique of helping to settle for me what's happened in my upper cervical. I've done a lot to try to stabilize my upper cervical spine with doing Atlas orthogonal, chiropractic, activator technique. I've done my functional neurology eye exercises, but I had a pretty severe instability a year ago, like a 6 millimeter overhang.
Significant. Yeah.
And so while I got to a certain point, I'm also on the computer almost all day working, and I can feel that it's not optimal, and it does affect my nervous system. And just being here a few days and having you do your dry needling technique, which is really amazing. Like today, I feel like this calm ocean right in through here, where normally, it's kind of like this, despite doing the brain retraining, despite my vagus nerve toning, because from a structural standpoint, the brain retraining, the vagus nerve toning didn't change that curvature. It calmed down the feedback mechanisms of my brain, which is why I can function like I can. But I want to optimize my function, which is why I'm here.
Yes, I think that's really interesting, is that the kind of work both of us do can be used for people anywhere along their journey. So whether or not that you're bedridden and you're unable to function, you can make progress by starting with brain retraining. You can, essentially frame your mind in a position where it's like, I can do this. And from that, I can do this, you may start getting 5 minutes a day that you're practicing walking around the house. Or that you're, isometrically squeezing your neck a little bit just to create some kind of a strength. You're visualizing the healing process. Or if you're already somebody that only gets headaches at the end of the day, like after I sit for 8 or 9 hours, I start to get a little bit of a headache. These practices still can help you at that point. What Dr. Kathleen said is pretty interesting, because out of all the spots in the body, probably the most valuable is the connection between your brain and your neck. And I think that it actually extends, and this is something I've talked quite a bit about, from the heart to the brain. But if there was just one spot that can cause the most neurologic catastrophe, it's probably going to be in that upper cervical spine.
Yeah. And you want to know, I have seen over the last several years of working with a lot of Lyme and mold and chronic fatigue patients that this is often a missing link for them. Like, they will do the brain retraining and things, and they don't realize that if this particular structure is either unstable or really out of alignment, that it does affect their immune system and their ability to fully heal, because there's so much communication that happens in this part. And even for me, and I know this being a physical therapist, I wasn't able to fully get what I would call a complete reset without starting to address this in the last year. It's been a huge missing piece for me, and I'm such an advocate for it, because I think it's going undiagnosed in a lot of people who are trying to heal, but a lot of practitioners don't know to look at the upper cervical alignment and see is that contributing to their chronic condition. And if we were to address that, could that help their brain retraining and nervous system reset just expedite in its outcome?
And their medical interventions be more successful as well. So if your nervous system is at ease, at peace, and functioning optimally without being hypersensitive to anything that it encounters, you're probably going to respond better to medical management. You're going to respond better to physical therapy. You're going to respond better to just the brain retraining program that you do, which there's a direct overlap. The brain retraining is physical, it is mental, it's the thought processes, it's the way you move through space. If you remember that you always were sick, and people, maybe you had a tough high school or upbringing, and you felt like you carried yourself here, and you had a heavy emotion about something wrong, or you weren't included in the group you wanted to be. And then in your adult life, as soon as something goes wrong or somebody says something that you don't like, you start to take on that posture again. And so it's both a physical reset and allowing that trauma to heal that can be a big part of reclaiming a healthy nervous system. But when you've been in that posture, let's say 10 years, 20 years, it makes sense that some of the connective tissue or curvature can also now have a structural origin of some of your symptoms or of having a weaker nervous system than you.
I think a lot of people, the whole nervous system world is blowing up right now, and brain retraining and vagus nerve exercises and somatic exercises are all the rave. But going back to my origin, being a physical therapist, this physical structural alignment piece, don't underestimate how much that is influencing these things. And so many of us are spending a lot of time doing practices which are great, but I think that in my experience, just even in the last year, adding in intentional, careful adjustments, intentional exercises, and now taking this next step with this therapy that I found out you're doing, I feel like I really am hitting all of the pieces of the puzzle and representing what I speak of, which is optimizing brain and nervous system health for being resilient. And I believe this piece that you're doing it's going to be a game changer. You've got some cool things coming.
Thank you. I'm really excited to be able to provide a little bit of a light to an area that's already really gaining publicity as a missing link in chronic conditions, which has been your neck health, and how that relates to your brain and nervous system health. So a couple of the interesting things that I've been working on have been how much of an impact that the tendons have on nervous system health. And just to reiterate that when tendons are chronically degenerated, which happens from prolonged abnormal posture, which can happen from certain medications, people talk about the fluoroquinolones, there's also other things in our food that have toxins that could maybe not be good for our connective tissue. If we're in a chronic sympathetic state and our cortisol is through the roof, if our blood sugar regulation isn't correct over time, many of these things can start to influence our connective tissue and end up influencing how our brain connects with our reality. So if your connective tissue, especially in your neck, as Dr. Kathleen knows, and it is very important that there's enough integrity. Nothing needs to be perfect. I'm not perfect. I have a lot of problems. I'm sure you would say that you're not perfect either, but there needs to be enough integrity of your connective tissue and your ability to hold your head in the right place for your nervous system to really feel healthy, to be able to work without interference, and to reach that spot of nervous system regulation.
Yeah, I've been surprised to see this idea of really approaching the tendons being a key place to focus for therapy. In the ligament laxity world, which is spreading like wildfire right now, we talk about the nervous system. We talk about prolotherapy for the ligaments, and of course, some people are talking about our blood sugar stabilization and medication. But what I think you're bringing forward in a way that I hadn't heard before being introduced to you was targeting the tendons. And I think it's going to be a game changer for people who are dealing with this. I mean, I've been doing this with you for the last couple of days. It didn't involve prolo. It didn't involve surgery. It didn't involve some crazy adjustment, which is exciting. So for those who are dealing with ligament laxity, describe a little more about what can happen by doing these techniques such as dry needling to directly impact the tendons versus some of the other therapies.
When people have ligament laxity, it's almost always that they have tendinopathy as well.
Which means
a chronic degenerative process in the tendons.
Okay.
So when tendons have been exposed to excessive force and they're not given adequate time to heal, they start to undergo a process called creep, hysteresis, and set, where they elongate just a little bit, and after they elongate, then the cells in them kind of tighten together, so now they don't allow, through diffusion, the little bit of blood that gets into a tendon that brings nutrition or removes waste. They limit or block that ability. And then as they fail to repair, the brain builds little tiny blood vessels into them, and also sympathetic dominant nerves, which are a failed attempt to heal, is what the literature has shown up until this point. And maybe in the future there will be more clarity as to why it's a failed attempt to heal. But that sympathetic dominant nerve in the tendon, it ends up telling the muscle to shorten and not contract as much.
Oh, interesting.
So one of the main reasons that we end up getting muscle shortening, weakness, And then also sympathetic dominance due to connective tissue is the tendons, in my opinion, because we have over 4,000 tendons in our body and there aren't as many ligaments. Ligaments are critical for holding bone to bone, but tendons are what allow us to muscularly control our posture. So for example, if I'm sitting and I'm holding my head up, right now it is primarily my tendons gently active that are keeping me in this position. Now, if I'm at the end range of motion and I'm holding here, you can start to get into stressing the ligament, which prevents excessive motion. And tendons control motion. So if I'm controlling my posture and feeling at ease in this position, like I don't have to try to sit here, then that's a good connective tissue control through the tendons primarily. So when people have instability ligamentously diagnosed on DMX or upright MRI with flexion extension or any other means, it's a good idea to get it treated. I mean, I've had regenerative medicine done to my neck, I think 9 times. And it did get me about 50% better from what I felt from a stability perspective. But if I jumped, Dr. Kathleen, if I drove in my car, if I tried to play ice hockey, you want to know what happened? I would feel extreme lack of safety in my nervous system. My nervous system felt on edge. I felt vulnerable. I felt like if I got hit one time that I was going to be knocked out. And this was after gaining some ligamentous stability. So once I started treating the tendons, it is a 95% gone. I mean, it's just amazing. 95% gone.
This is so hopeful. I hope you guys that are dealing with the, whether it's Ehlers-Danlos or maybe upper cervical instability, this concept, I haven't seen anybody focusing on this before on the tendons. And as you're speaking as a physical therapist, I'm like, this makes so much sense. Like, it doesn't need to be all this doom and gloom. And that's sort of how it felt to me when they said, hey, you've got severe upper cervical instability, you might need to have surgery, you're going to need to have prolo. And I didn't accept that a year ago. And many of you guys know who've listened to my story, I've been looking and doing what I can to stabilize. And I can just tell you, just 3 days of this, I feel absolutely like a softness that I haven't felt in probably years.
That's amazing.
So I know what you mean by this sympathetic taut, the way it's tried to keep me safe, that's just actually just kind of keeps you like this.
Yes.
And so I'm excited to see what can happen with my own situation, as well as many others who are on this journey trying to heal and thinking that the only way is to find a way to tighten their ligament.
Yes, and it's a good point, because upper cervical instability, ligamentous, is true and a real condition. And some of them will require neurosurgical stabilization or fusion. Some of them will require deeper ligamentous intervention and or posterior prolotherapy. However, I think the really interesting commonality that we're seeing again and again, specifically in my practice, is that individuals now, many dozens of them, repeatedly again and again, and I only see 5 patients a day, and some of them start with me and finish their care elsewhere. So the amount of patients that I'm seeing in each month that I'm seeing all the way through is very few. And I would have to say that a lot of them, upwards of 80%, will have 4 millimeters, 5 millimeters, 6 millimeters of lateral overhang of C1 on C2, and will reclaim their health in the absence of deeper ligamentous care. And so it's not to say that they're not a little bit vulnerable, Dr. Kathleen, if they were holding their neck like this for 10 minutes, straining the alar and the transverse, they may start to feel symptoms, but they return to work, they return to going out with their friends, with their spouse, they return to doing the things that they love and feeling safe in their nervous system, and the symptoms are also going away. So the tendon control of the spine is more important than many people think. And your nervous system can be insulted and recover. So what I mean by that is if you have 6 millimeters of overhang, when you're fully here, well, the amount of time that you're in that position in a day may be 1 minute. You reach under the counter, and if the rest of your nervous system is functioning well, you're doing brain retraining, you've got the tendons online, you have a pretty good spinal curvature, your body can bounce back from that insult, and usually without worsening of symptoms or without feeling like you're on this tipping or rocking boat.
So What I think is great is you do have this technique that you're doing for dry needling, but that requires somebody to come and be here with you.
Yeah.
And I know you're working on something where anyone in the world can actually get some of this help to reshape the curvature of their spine with a machine-generated app to analyze their posture and help them start at home working on just the things we're talking about. So tell us about that.
Yes. So first of all, people like you inspire me to do what I'm doing with the posture software because of your influence on people all over the world. I mean, when I just follow your page and I see people that are literally from every corner of the globe that are getting benefit and starting to heal from home, people that maybe only have a little bit of resources or, have tried everything and they're finally making a turn. And, your story has inspired me also through interacting with potential patients that have been unable to come in person. We're releasing an app, and the app is called PostureVision. And PostureVision is going to have all of the information that I have learned over the last 12 years being a chiropractor built into it through machine learning or a form of AI algorithms. So we have over 10,000 images as a data set, 2 million data points, and it's going to track you as you move through space to help you improve and maintain posture. I think it's going to be pretty interesting because a big part of what I do with clients when they come in here in person is very detailed, subtle changes to their posture. So, you may be standing right here and I'll be like, okay, so this part of your rib cage, engage that more to the pelvis and then barely activate the left side of the glute. And then your left ankle falls medially. So pull up a little bit and squeeze through your hamstring and pelvic attachment. And this software, in theory, as it evolves and grows and gets smarter, will be able to guide you through all of these insights to help with human movement, with gait, with spinal curve correction, with being in tune as we add in another layer, which will help even detect eye fatigue, is going to know when you're starting to need to take a break so that you may be challenging where your nervous system is so we can prevent people from getting big flare-ups. Because we all have a limit and we all test that limit because we want to get as much done as we can and live the most vibrant life. So whether your limit is 10 at night that you need to rest or you're going to get sick, or it's 12 noon, if that's where you're at, it can help to start to detect when you're going to need to take a rest, when you need to step away from the screen, and then give you custom exercises based on your unique profile that's built and what you tell the app, because you'll be able to communicate with it and tell it that, hey, if I do this exercise that you recommended, it really hurts in my left shoulder. Then through manual intervention initially and then fine-tuning the software, it'll create solutions around that and recommend brain retraining programs, eventually recommend different things you can ask your doctors if you hit a plateau or you're still unwell. And the data that's collected can also go to doctors' offices through a more like enterprise version. And the doctors will have a whole wealth of knowledge on what's working for you and what's not by the time you show up at their office to help deliver more meaningful and quicker results in care.
So for somebody who is dealing with some type of chronic condition or pain or whatever, this is an app that will basically analyze what your current posture situation is, what might be imbalanced and contributing to affecting your brain to body connection.
Yes.
And then we'll give you exercises specifically for you based on your analysis to optimize the posture and improve that brain to body signaling.
Yes, correct. And the most brilliant thing about it is that you can turn it on or off anytime. So whenever you have 5 minutes and you're like, hey, I want to work on my posture, you can do it. And you don't have to go to an office to get this done. The inspiration behind the idea, besides seeing other people helping individuals heal from home, like Dr. Kathleen and a few other people that I've been blessed to have as people that I know and are friends in my life, has been that I've coached probably about 20 people on their posture and seen some pretty amazing effects just through Zoom calls and only coaching them on posture and seeing how they had more duration of nervous system integrity or balancing throughout the day just from recoaching on posture. So I knew then that it was possible to put this into a product that for a very small cost, people anywhere in the world can start to balance the structural or postural side of their nervous system health.
And what kind of time commitment a day are these kind of exercises?
The exercises typically will be 5 minutes or less a day, and maybe up to 10 to 12. So we want to make it so it's really sustainable, easy to do, and the most primary or most valuable thing that individual needs in that moment to start to bring them back towards integrity of the nervous system.
And are they going to need any special equipment?
There will be some equipment. Some of the postural products that I use and the standing weights will be something that's built into it, probably at a little bit later into the year. Initially, it'll be more at-home exercises, maybe with bands, things you can do that are pretty easy to obtain. And then we will be adding in the standing weights. And then also later in the year, we anticipate starting to add in combining your physical posture photos with images such as standing x-rays to provide even deeper and more meaningful insight.
Now, somebody who does have upper cervical instability, are these exercises things that they can safely start trying at home? Because I know some of those people are really vulnerable and they can't go to the gym and exercise.
Yes.
So what about for them?
Yes. When you first sign up for the app, there's going to be a pretty significant kind of like a questionnaire or a qualifier to see where you'd fit in. Mm-hmm. And if you have upper cervical instability, you have a hard time holding your head up for more than 30 minutes, there will still be a place for you with the software. So once you say, you put in, I can only hold my head up for 30 minutes or I feel weak, I've tried isometric exercises and it makes me feel worse, then it's probably just going to guide you on subtle posture changes. Like, let's say if you're always like this when you're standing or sitting, it may just gently guide you. Bring your shoulders up and out just a hair and your lower neck in. And now in this position, just kind of get used to your body there. So it will be able to be scalable, depending on where you are. The goal of the software is to meet the individual where they are, whether they're feeling rather weak or if they're trying to just optimize a lift and they say, when I do a shoulder press, I can't go above 20 pounds, and we figure out the posture that's going to allow that to happen without clicking and popping or neck pain.
This is kind of a side question, maybe related. So some of the people with this instability, a lot of them have POTS or postural orthostatic tachycardia. Yeah. So what is happening there, and why would addressing their posture help with POTS symptoms?
Yeah, that's a great question. The individuals that I've helped that had POTS symptoms, it typically was strengthening the neck and as well as creating an opening in the front for the blood flow, carotid artery to the head, and then vertebral, and then also the jugular vein back out. So the way that I think about it is when you make a quick transition, so sometimes it happens from sitting to standing. And if I go from sitting to standing and I let my neck go forward and my shoulders come back, I risk a couple of things. One of them is kinking of the vertebral artery, as the vertebral artery is in between C0 and C1 on the right and the left, and then it travels more medial and goes up into the skull. And right where it wraps around C1, if you do the jutting forward, on occasion with upper cervical instability or tendinopathy and a weak neck, a bad curve, you can create a torquing on the vertebral artery, which intermittently changes the blood going into the head. And then your body has to correct for that. So your carotid baroreceptors and chemoreceptors start to say, oh, blood pressure higher, blood pressure lower, heart rate, go, we need more blood. And so that can be one of the reasons why. Another could be if there's a deeper injury and a change in the clivoaxial angle or something, and you're getting brainstem compression with certain positional changes. And thirdly is you can be pulling your clavicle back too far, and this can actually cause lower jugular vein or thoracic outlet syndrome, where temporarily you're hitting the vagus nerve, the jugular vein, the carotid artery, and then sending that kind of a signaling again, just like similar to what would happen if it were the vertebral artery. So those are some of the main reasons why. So something that I really tell people that have POTS before they come in person, and I would advise them to do from home, would be to think about widening the shoulders out, trying to also bring your spine forward and backward, almost like a circumferential opening. And when you get up, try to use your legs and keep your head in a much more stable position. So to try to come up from here, instead of hinging forward, and going in that position. A lot of people, when they lay down, they lead by coming up like this instead of bringing themselves up sideways. So that's one thing you can start doing that may help at least take you the right direction to begin.
And so these exercises from the app that might help to strengthen their overall sense of posture and hopefully help to alleviate some of these POTS symptoms as well?
Yes, I would think that it's not going to be, we are submitting and we're working on basically a process where we'll get FDA approval to use this as a software, as a medical device. However, we're not anticipating that we're going to use the software to necessarily treat illness or disease. However, we're going to use a lot of the testimonials and case studies that as a result of improving my posture, my alignment, my curvature, that these are the things that actually fell by the wayside, and this is how I feel now. And that list is already building. I already have about 7 or 10 testimonials of people that have just done remote coaching that I haven't released yet, of people that have gotten their life back, they're able to work longer through the day, headaches are down, they had headaches for 10 years, we just worked on posture and curvature. And so, yeah, I mean, these things really do make a big difference. Like Dr. Kathleen said, we think that just like there was a huge awareness around Lyme's, there was a huge awareness around mold. There was a really large awareness now around ligamentous upper cervical instability. I think that the curvature and correct muscle activation will be a very supplemental part to already, and brain retraining to all of these programs.
Yeah, I've been a bit humbled with my own background being a PT and knowing about posture being so important, and yet when I was going through all of my own recovery, it sort of fell on the wayside because it just wasn't talked about as much. And now here I am in this later stage, while I have my life back, there's this piece because my spinal curvature of my neck it's basically straight, and therefore I ended up getting a lot of instability. But seeing how important it is to go back to my origins of training, that posture matters. It matters a lot for not just muscle and joint health, but for immune health and brain function and all of these things that I wasn't really taught back in PT school.
Yes.
And when I was going through my situation, I actually didn't have pain and joint pain because it was just not something that happened to me. So I didn't really think about my curvature of my neck as part of my nervous system recovery. So I'm getting to come full circle, and it's been really fun to nerd out with all of this stuff with you.
I've been having a blast.
So you guys on this healing journey, your posture is important. It's a big part of it, and it absolutely is part of your nervous system rehabilitation.
Yes, 100%. Your posture is part of your nervous system rehabilitation. And in many cases, when you've lost your posture, it can be imperative that you include that as part of a more comprehensive plan towards reclaiming control over your brain and keeping your nervous system where you can be the one running it instead of it running you.
Yeah. You know, I just want to say from my own experience, so I've spent the last year trying to rehabilitate my upper cervical instability. Every time it seems like I get somewhere, like maybe I was really diligent with, Atlas orthogonal and my chiropractic and my exercises for a while, and then I'll just like kind of let it go, and I'm on the computer and working on my phone a lot, and sure enough, within a handful of weeks, I start getting that funky feeling back.
Yeah.
I feel like our screens and our phone use, it's not like it used to be 20 years ago where you do a rehabilitation process and then you're like good to go, because we go right back into the positions that straighten the spine and jut your head out. Yeah, so speak to that.
That's a great point to bring up. And it's the reason why that I started to figure out how valuable the tendon dry needling was. And it's because people are like, well, you're just like people say, well, you talk all about the brain retraining, and why are you recommending something physical? Well, it is actually nervous system retraining. And just like people will tell me, well, you're a chiropractor, shouldn't you only do adjustments of the spine? No, that's where chiropractic started. But really, chiropractic, if you look up in the state-by-state law, like what it says that our function is, it has to do with the nervous system. And so we're trying to bring integrity to the nervous system to let the natural ability of the body to heal be able to work without any interference. And so what's happened now, what Dr. Kathleen said, was that because of our modern world of driving a lot, of being on the phone, of being on our computer, of sitting a lot, of being in front of ourselves all of the time, that the tendinous component is actually much more prevalent than it was 20 or 30 years ago.
Yeah.
When an adjustment alone or one round of prolotherapy would have been almost a curative,
Yeah.
it now, in some of these more difficult, complex cases with loss of curve, with chronic symptoms, it can be more of a temporary. And being a chiropractor, I still absolutely believe in the power of gentle, specific chiropractic care. It stopped giving me the long-standing changes. I mean, I was getting adjusted by the best chiropractors, and I would feel better, but then my tightness and pulling would come back. Then when I would drive, I would feel a little bit of like a mal-day debarkment or a nausea. And then if I would jump, I would feel dizzy. And if I would play ice hockey, I'd feel like I was gonna get killed if I got hit one time. And now I'm back to playing ice hockey. I'm back to rock climbing. I'm back to climbing to the top of mountains in Colorado. I'm back to, I can do a somersault. That was a big test for me because of how weak my neck was, and I felt dizzy and vulnerable. On my bed, I did like what kids do, but I wanted to see that I could still do it. Yeah. So I did a somersault over like on the back of my neck and head and popped right up without any dizziness.
Wow, I'm not that brave yet.
But really, where do you start and stop with nervous system and brain retraining? Because at a certain age, maybe that's not possible, but I'm only still in my later 30s. I'm hanging on. The point was not about my age, but that, I still felt like that should be possible for me to do without feeling unwell.
So yeah,
Did I answer your question?
Yeah, and I'm so inspired by your story too, because you have pretty significant upper cervical instability.
7 millimeters to the left.
Well, you beat me.
5 to the right. It's not something you want to win the award
I know,
for.
you win. That's amazing.
Yeah.
And I can't even imagine doing a somersault right now. So that'll be my goal.
Yes, yeah. It was a good goal because it challenges, you land carefully right on the back of your head and be able to roll over and pop up. And to me, that was a big sign. At my worst, I was at a football game, and it was during one of the most stressful times of my life. I was working the hardest job that I ever had. I was working all the time, and I went to a football game, and somebody threw a big pass, and I stood up quick to celebrate, and I was up in the high stands, so they're steep, and I thought that this may be my last couple breaths, and I kid you not, I had this dizziness overcome me and this faintness and a pounding in my head, and I felt like I was gonna fall and just lose it. And thank God, 3 seconds later, I started to come back before I fell. Wow. And that's when that was the worst moment for me in my condition, where many people that I consult with, they've actually had the syncope. They've actually fallen, hit their head, had to get jaw work redone, their head, they get neck injury. So I'm so grateful that it stopped there. But yeah, I mean, my symptoms, they were pretty bad. I never had to stop work, but I felt sick. I felt real sick. So
how ironic you became a chiropractor and had this upper cervical instability, so that you could learn about it and develop techniques like you are to change the game.
Yes.
And I love that. Why do we have to go through what we do to end up teaching others?
I know. Yeah.
But even for me, a year ago when I had all this diagnosis of upper cervical stuff, I'm like, what? Why this now? And I really believe it's because I was meant to learn about another piece of optimizing my nervous system health that was a player the whole time. I just didn't know it for 15 years. I was on the Lyme train and mold train, and all my weird head symptoms are oh, that's Lyme. Well, I think a lot of them were upper cervical instability. So I'm grateful to have the knowledge, and I'm grateful that there are tools that don't involve crazy surgery necessarily for me, at least at this stage. So
yeah, I agree. Whenever possible, it's best to avoid invasive surgery. And if there's progressive neurologic decline, you definitely need to get surgery. But I felt inspired to pursue this path in life, just going through with what my brother had to go through. Surgery saved his life, so I'm always forever grateful for surgery. But I still know that if there's a way to avoid it, that you really should try everything you possibly can, because it does have side effects as well.
Well, I'm excited to see your new machine app for us to be able to do our exercises at home. Especially, I know so many of my members, they're definitely not able to travel or come see you. And and or even afford to like go work with somebody on their posture. So this is going to be a great stepping stone, an affordable stepping stone to start optimizing their spinal curvature and improving that brain to body communication.
Awesome. Thank you so much, Dr. Kathleen.
Yeah.
It's been a pleasure to speak with you today, and I look forward to continuing to collaborate in any way we can to help people.
Awesome.
Okay. All right. Thank you.
Yep.
Okay. Good.